Good morning, everybody, and welcome to this session. We've got a full house. My name is George Tembo. I work for the United Nations Population Fund in New York. And I would like to introduce my co-chair, Dr. Marijke van Rox, who's the ambassador for AIDS for the Netherlands. And she has over 20 years experience working on HIV/AIDS. And she was previously the chairman of the PCP board for UNAIDS. Just to remind you that this session is being simulcast to Kolkata. So we've got some of our panelists there. And so there's an interactive discussion between us here and in Kolkata. And I've been asked to give an announcement that there are headsets available outside for those who want the session to be translated. So just outside there are headsets that you can go and get. So the way the session is set up is that I'll give just the objectives of the session, and then we'll go on to ask our panelists to say a few words and a very short interventions for 5 minutes. And then we'll go to Kolkata, where some of our panelists are also there. They'll give them the interventions. Then at the end of it all, we'll take it to the audience here and in Kolkata to have an interactive discussion. So let me just give you few objectives of the session so that we are all on the same page, so that we know what we want to achieve in this session. We want the session to provide the basis for the legal, policy, labor, and public health rationale for creating an enabling environment in which sex work is integrated into communities as simply another occupation. It aims to discuss sex work from a labor rights perspective, moving beyond the sometimes paralyzing discourse of sex work as inherently sexually exploitative. Sex work networks and organizations have advocated for many years that sex work should be viewed as work, and this is an essential component of a human rights-based approach to HIV prevention, treatment, care, and support. There have been several recent reports, research, and recommendations that are set to significantly influence the global agenda on this. The ILO World of Work Recommendation 200, the report of the Global Commission, which was recently launched in New York about a few weeks ago, the UNAIDS guidance note on HIV and sex work, which was reissued in 2012, and the WHO, UNFPA, UNAIDS Secretariat, NSWP guidelines on HIV and STI prevention and treatment among sex workers in lower and middle-income countries. Additionally, there's also research on the global epidemics among sex workers undertaken by Johns Hopkins University and the World Bank. And also, most of you know about the investment framework, which provides an additional important vehicle for transforming responses to HIV and sex work. As I mentioned earlier, this session will be interactive among the panelists, both here and in Kolkata, and it will be led by both me and Ambassador. It will highlight the perspective of sex workers, look at new information on the scale and nature of the HIV burden on sex workers. It will also consider sex workers' work and ILO Recommendation 200. And it will discuss the recommendations from the Global Commission on AIDS and the law, which was launched recently, as I said earlier on. The interactions will address the need for enabling environments in which HIV prevention for sex workers can be implemented effectively. It will also consider the comparative advantage of regulated and protected sex in contrast to the social, financial, and health costs of criminalizing and stigmatizing sex work. So those are basically the objectives, and those are the things that we would like to achieve in this session. So to start the ball rolling, I would like to ask Ambassador Marijke, you as the previous chair of the PCB, ambassador on AIDS, and you've had extensive experience, can you just describe what you think the current political environment on sex work is like?
Thank you, George, and of course really pleased to respond to that. I think the first very significant response is that, of course, we do have this panel discussion across 2 locations. with the sex worker meeting in Kolkata because they were denied entry in the United States. So I think that's a very clear response to the question on political context. I myself am from the Netherlands. In the Netherlands, sex work is legal. It's considered a legal occupation, which means that sex workers are protected by labor laws. It also means actually that sex workers in the Netherlands pay income tax, so there's downsides to everything. And the Netherlands also, I think, is one of the very few government donors that supports sex worker programs internationally. So, but there's also a downside to that. Over the last couple of years, we've seen an increasing tendency to more strictly regulate sex work in an attempt to control human trafficking. I think all of us in this room know that this is doomed to fail because human trafficking and sex work are two very different issues and should not be confused. But still, this is happening, and just as a side note. But also, as George alluded to, there's on the positive side, there's a lot of emerging evidence that sex work is work and that the current legislation that many countries do have in place that limit the right of sex work and criminalize actually sex work, both the clients and the sex worker themselves, is counterproductive, both from a human rights perspective and from a public health perspective. We've heard very powerful testimonies this morning in the plenary just to underscore those issues. And we have a lot of experts in the panel that will be talking about this recent evidence, and very much looking forward to it.
Thank you. Thank you very much, Marika. Our next panelist is Naomi Akers from Washington, D.C. Naomi has been a passionate advocate for sex worker rights movement since 1995. She has worked in a variety of sex work venues, both legal and illegal, including Nevada brothels, escorting, exotic dancing, message parlor work, and street-based sex work. She is a member of the San Francisco HIV Research and Vaccine Trials Network and Community Advisory Group for the past 4 years, from 2009 to 2011. As of August 2006, she is Executive Director for the St James Infirmary, a free medical clinic for sex workers where she started as a volunteer in 2002 and has been a client since 1999. Naomi, from a sex worker's perspective, why should sex work be seen as work?
Good morning, everyone. First, I just want to say thank you to everyone for being here. And to open up with a quote from a sex worker in Uganda, a sex worker from Uganda who was in the march in Calcutta the other day from the Freedom Festival. When you're doing sex work, of course you see it as work. It buys your food, pays for school. If it was decriminalized, if one could choose to be a sex worker in a safe environment, I think it would be a good job. What makes it bad work are the laws and policies. I want to give a shout out to the sex workers in Calcutta. I saw pictures from your march. It was very beautiful. I'm not sure where the camera is filming, but to say I wish we were together, how sad it was that I couldn't meet you. We're supposed to be turning the tide together. So, I'm not crying. It's just the light in my eyes. Okay. I was trying to prepare for that question. Why should sex work be work? And honestly, I got a little angry because I'm tired of defending my profession. I don't understand why I should be asking that question. I guess my question is, why shouldn't it be work? It's a profession. Work, I looked it up in the dictionary because I'm like, am I missing something? Work is an exchange of a physical or mental activity for currency. It pays our bills, it pays our rent, it pays for childcare. It provides health care for our families. This is a profession. I did it in illegal environments and legal environments. It was very, very different in those two contexts. The whole visa issue with coming to the United States, I just want to say, what pisses me off so much about it is the question is about, have you done anything immoral? My sex work was not immoral. I was very upfront and negotiated with my clients. Thank you. I was transparent. This is what I will provide. This is what I won't provide. This is how much it's going to cost. Would you agree to that service? Yes or no? And then we went on with it. The problem is is the policies. For most sex workers, they're either working illegally, so we can't organize. We're living in shadows, we're living in secret. We can't talk to our healthcare professionals about what we do, so we're not getting adequate occupational health and safety care. We're afraid of stigma. We can't talk to our families about what we do, our work, without a tremendous backlash. Imagine having a job where you couldn't tell the closest people in your lives what you do for a living if you had a bad day and you just needed to process, that you had to keep all of that inside. And then how do we find each other? Having sex worker professional organizations is criminalized, and often it comes with a sentence enhancement of being a felon or being labeled a trafficker or a pimp. We come here to this conference because there's so much funding around HIV and sex work. And then I come here expecting to meet with my sisters and brothers in this profession, and they're denied access to this country. It's very sad. For sex workers in the United States who work in legal settings, they're defined as independent contractors. And under our laws, independent contractors don't have the right to organize and form unions. And here's an example of how this gets played out. In Los Angeles, porn actors were denied access into the Actors Union, the Screen Actors Guild. That was supported by a law because of what they do for a living. And then we see yesterday on the ballot in Los Angeles, lawmakers are trying to put an initiative to require condoms in porn and to require registration systems with the state without giving us any benefits or any inclusion in that process, the right to better wages, the right to determine our own workplace safety. So I'm tired of saying all of these people want to regulate our bodies without giving us any rights. We want the rights. We'll tell you what we need. Please listen. Thank you.
Thank you very much, Naomi. That was very clear. Our next speaker is Deanna Kerrigan from Washington, D.C. Deanna is an associate professor in the Department of Health, Behavior and Society at the Johns Hopkins Bloomberg Public Health. She has been conducting research related to HIV prevention and sex work for over 15 years, including intervention research related to social and structural factors and HIV risk among sex workers in the Dominican Republic and Brazil. She's recently led 2 initiatives sponsored by the WHO and the World Bank and UNFPA to document and model the role and impact of community empowerment-based comprehensive HIV prevention among sex workers in lower and middle-income countries. Deanna, our question to you would be, what is the latest research telling us about the nature and scale of the AIDS epidemic among sex workers?
Thank you for the question. Since the beginning of the global HIV epidemic, sex workers have been known to experience a heightened burden of HIV. However, sex workers' HIV and health risks and rights have often gone unattended, and global resource allocation related to HIV prevention, treatment, and care has not been based on rigorous analysis in terms of the public health and social science evidence related to sex work and HIV. As part of an effort to understand the global epidemics of HIV among sex workers, a systematic review was recently conducted on the prevalence of HIV among female sex workers, whereas other recent reviews had been conducted on male and transgender sex workers by our team at the Johns Hopkins School of Public Health. This covered data from the last 5 years, over 100 studies, 50 countries, and 100,000 female sex worker participants. Details of the systematic review and meta-analysis will follow in a session later today, but I'd like to highlight some of the findings. Overall, HIV prevalence among female sex workers across regions was approximately 12%. The highest HIV prevalence among female sex workers varied significantly by region, with the highest prevalence found in sub-Saharan Africa, with a pooled HIV prevalence of 36.9%, and individual country estimates surpassing 50% in some cases. Across the region, HIV prevalence among female sex workers was approximately 14 times greater than the overall prevalence among the general population of women of reproductive age. sex workers experienced significantly higher risk than their general population counterparts in every region, including a 29 times greater risk in Asia, a 12 times greater risk in Latin America, and a 12.4 times greater risk in Africa. To better understand not only the level of burden, but also the nature of burden of HIV among sex workers, we also conducted 8 countries' case studies examining the policy and social environment surrounding access to services and risk among sex workers across settings. In settings where sex work is recognized as an occupation, an enabling policy and social environment can be created whereby stigma and discrimination against sex workers can be directly addressed, and access to prevention and treatment services can be facilitated. However, these settings are few and far between. The coverage of HIV prevention services among sex workers is low, with generally less than 50% of sex workers reporting access to very basic HIV prevention services. This level of coverage is unacceptable, given the high burden of HIV experienced by sex workers, as indicated by this recent review of the literature. Few systematic HIV interventions were documented for male and transgender sex workers or the clients and regular partners of sex workers in our review. Consistent condom use between sex workers and their regular partners was significantly lower across geographic settings, although quite high with new clients across contexts. These data indicate the need for a review of the UNGAS indicators, as well as the need to reach regular paying and non-paying partners of sex workers with HIV prevention efforts, rather than focusing solely on new or most recent clients in terms of both programming and monitoring and evaluation efforts. I'd like to briefly share some highlights from 2 of the case studies that we documented, first from Brazil, a concentrated epidemic, and then from Kenya, a generalized epidemic. Brazil is known for engaging socially marginalized population groups through community-based organizations in their internationally recognized response to HIV, including but not limited to female sex workers. The overall prevalence of HIV is less than 1% in Brazil. However, the median national prevalence among sex workers is approximately 5%. Despite significant gains in tackling structural factors associated with sex work, including gaining recognition of sex work as an official occupation in Brazil, stigma, discrimination, and violence still continue to exist in Brazil with regard to sex work, whereas 15% of female sex workers reported having experienced some form of sex work-related violence in the last 4 months in a study of sex workers in Rio de Janeiro. Additionally, less than half of sex workers, even in Brazil, which has historically prioritized the needs of this group, have appropriate access to HIV prevention services based on the most recent UNGAS indicators. We know that promoting and sustaining safer sex and reducing HIV involves more than just access to testing and receiving condoms. And in turn, the level of programmatic reach with comprehensive empowerment-based HIV prevention interventions, which have been proven effective in Brazil, India, and in other settings, is quite low, much lower than even the UNGAS indicators represent. Such data suggests that even in the context of important gains and successes with regard to sex work, human rights, and HIV prevention in settings like Brazil, sustaining significant investment in HIV prevention among sex workers is critical. We can also explore a different epidemic scenario, such as a generalized epidemic in the case of Kenya, which has a very different legal and policy context surrounding sex work, where sex work is not recognized as an official occupation and where sex work is often criminalized under the guise of multiple types of indirectly related laws and legal codes. Currently, HIV prevalence overall in Kenya is approximately 6%, nationally 8% among women, whereas with the HIV prevalence in terms of pooled data for female sex workers in Kenya is approximately 45%. There is also little indication that overall prevalence among sex workers in Kenya is on the decline, despite significant declines nationally in that setting. And mathematical modeling has shown that up to 14% of new infections in Kenya are associated with sex work, even in the context of a generalized epidemic where traditionally less attention has been paid to these issues. In terms of programmatic reach with effective HIV prevention services, according to the most recent UNGAS data, only 59% of sex workers in Kenya were able to identify the main modes of sexual transmission and reject major misconceptions about transmission. We also find from the literature that 32% of Kenyan sex workers reported some form of physical or sexual violence in the last year, and that rape, including gang rape, from state actors, including police, is quite common in this and other settings. There is a clear need for additional resources and investment in sex work, human rights, and HIV prevention in the context of this and other generalized epidemics where less attention has historically been paid to sex workers. Let me close by saying that our comparative analyses from our 8-country case studies indicate that sex worker leadership plays an integral role in the development and sustaining of effective community empowerment-based response to HIV prevention among sex workers. We see that where sex worker organizations have been funded and have been able to partner effectively with government actors, the response to HIV among sex workers has had a significant impact in stabilizing and reducing HIV. In turn, support for sex worker rights organizations is critical to sustain an effective response to HIV and the promotion of sex workers' human and health rights. We do need more systematic assessments of the epidemiology of HIV among sex workers, but also research that further documents the ongoing increased structural and social vulnerability of sex workers to HIV. Lastly, given the dramatically heightened burden of HIV risk among sex workers globally, comprehensive community empowerment-based HIV prevention, treatment, and care, which we know from the literature and our recent mathematical modeling to be effective, should be expanded immediately across settings to address the needs of what is clearly a radically underserved population. And this expansion in services and investments should include not only female, but male and transgender sex workers and the clients and partners of sex workers. Thank you.
Thank you. Thank you very much, Deanna. Our next panelist is Richard Howard, who works for the International Labour Organization. Richard has got extensive experience on HIV AIDS and currently works as a senior specialist, senior advisor in the Asian Pacific region. Richard, you recently, yesterday actually, you had a session on this. I want you to talk a little bit about the recommendation 200. But more importantly, I want you to tell us what implication it has for sex workers and for sex workers' work.
Well, first of all, I'd like to say that it is undeniable that sex work is work, and that sex work is a legitimate form of economic activity. However, the question arises, is sex work decent work? And the answer is clearly no. Now, this is not decent work in the sense of morality. I grew up in South Carolina, and my mother would have a very clear idea of what was decent and what was not. But decent work for the ILO has nothing to do with morality. It has everything to do with, are the fundamental rights of workers protected? And decent work is based on several fundamental rights. The decent work agenda delivers on, is created or enforced through the development of labor standards with the fundamental role of ILO constituent members. There are 188 member states of the ILO, and the constituent members comprise of labor departments, workers' organizations or trade unions, and organizations of employers. Decent work describes a working environment where wages are fair, where there are reasonable working hours, safe working conditions, and access to Social Security, including health care, accident coverage, disability benefits, and unemployment, as well as pensions. All ILO labor standards that have been developed to protect or promote decent work at the country level do not distinguish between groups who are included and groups who are not excluded. There has never been a formal exclusion from sex workers from any ILO convention. Decent work should exist and be protected for all human beings, regardless of the legality of work, regardless whether this work takes place in the formal or informal economies, or whether this work is recognized as work by national governments. So the question arises, why is sex work not decent work? And I think the purpose of this panel is partly to address that. And I think criminalization is a key barrier that we face, along with misinterpretation of religious doctrine and discrimination. I'd like to mention briefly Recommendation 200 as an intermediary strategy for addressing the working conditions and improved HIV prevention and treatment and services for sex workers. In June 2010, ILO tripartite partners developed a labor standard on HIV in the workplace to protect rights for people with HIV and improve access to prevention and treatment. It was very clear as I witnessed the second round of these parliamentary discussions that our partners wanted to ensure that groups that are most vulnerable to HIV were included in the implementation of the standard. And there was a great deal of discussion on sex workers and the importance of their inclusion and prioritization in the implementation of the standard. So what does the standard say, very briefly? It protects the employment rights of all workers with HIV. It prohibits mandatory testing as a condition to get jobs or to keep jobs. It ensures confidentiality of HIV status, prohibits firing or job switching due to HIV status, as long as people are fit to work, able to do their jobs as defined in job descriptions. Again, the priority of this recommendation, of this labor standard, was to focus on groups who are most vulnerable to HIV. I think one of the strengths of the recommendation is that it addresses fundamental factors which put workers at risk for HIV, including lack of occupational health and safety and protection from HIV transmission in the workplace. And it calls for protecting those workplaces which are most vulnerable to HIV transmission, and in addressing sexual harassment and violence in the workplace and lack of access to adequate health services. So these standards are all well and good. I think we have a solid international framework for delivering on this agenda, but very little has been done, as you know, at the country level. So what can we do? And I think our role as the ILO is to facilitate partnerships with those members of the ILO constituency. First and foremost is the role of trade unions. As we noted, all workers have the fundamental right to organize and negotiate for their rights under the protection of national labor law. Alliance with trade unions are critical. In Cambodia, the Food and Service and Entertainment Trade Union has integrated sex workers and has invited sex workers, and they participate in the trade union and have negotiated for better working conditions and with some degree of success. I think this is a model. At the global level and national level, the ILO responsibility to ensure partnerships, however sex workers would like to develop those partnerships, whether it's membership or some other type of alliance or affiliation with organizations that already exist. So trade unions are one very important route here. The second approach is to work with the establishments, with the management of establishments to implement ILO Recommendation 200 at the workplace level through establishment of a set of simple guidelines, as has been done in some bars and locations in Thailand. So workplace programs, not just in the factory or the mining company or the bank, but also in the places where sex work is taking place. Finally, the importance of working with national labor departments to ensure that standards and guidelines and policies are in place to implement ILO Recommendation 200 in the sex industry. So again, we're just at the beginning of this movement, and we have made some significant progress, but really most of the work is in front of us. Thank you very much.
Thank you, Richard, and I think that provides a very interesting bridge to our last speaker on the panel, Mandeep Dhaliwal, and also the last Washington speaker before we switch to Kolkata. Mandeep is the cluster leader of the Human Rights, Gender and Sexual Diversity at UNDP, and I think more than a cluster leader, Mandeep is an activist on all of these issues. Mandeep has been leading the work on the Global Commission on HIV and the Law. The report was published this week. It's a very influential report. And we would like to ask Mandeep whether she could go a little bit more into detail on the recommendations that are stemming from the report of the Global Commission on AIDS and the Law that would support the proposition that sex workers work.
I think I'll just begin by saying that actually the Commission reviewed public health evidence, human rights evidence, as well as heard accounts and received submissions from over 1,000 authors from 140 countries. So these recommendations have truly a global basis. And the second most important thing is that I want to say hello to colleagues in Calcutta, and many of them were involved in the regional dialogues and really came before the Commission and told and spoke of their experiences with tremendous courage. And a lot of that has very powerfully influenced the Commission's recommendation. The recommendations are based and predicated on the fact that the Commission recognizes sex work as a legitimate occupation. And so based on that, they looked at where is the most harm being caused to sex workers, what legal frameworks are actually making sex workers more vulnerable to HIV, and where is there example and evidence of good practice where actually legal frameworks support sex workers' rights, support them to be healthy, support them to be members of society, equal members of society. And they focused on really essentially on three key areas of law. One you heard Cheryl Over speak about this morning was the conflation of sex work and trafficking. And how anti-trafficking laws are actually really causing a lot of harm to sex workers because there's this misguided conflation that actually stems from poorly and overly broadly worded UN conventions, CEDAW and the Palermo Protocol. And so one of the recommendations is for the UN with partners to think about reviewing these protocols. We've now had them for a number of years. They certainly weren't, they were passed with the best of intentions, I'm sure, and in line with the Charter of the United Nations, which upholds the human rights of all citizens. But now we've seen that actually how they're being translated into national legal frameworks and how they're affecting the lives of vulnerable communities is a bit of a problem, so it's time for a review. So that's one of the major recommendations. The other recommendations are that we need to repeal laws that prohibit consenting adults to buy or sell sex, as well as laws that otherwise prohibit commercial sex in any way. Over 100 countries criminalize some aspect of sex work. And I think the call from this conference is very clear. It is time to decriminalize private, adult, consensual sexual behavior, and that includes sex work. And it has to be said clearly. I know I've been involved in or witnessed many discussions over the years where we say remove punitive laws, remove discriminatory laws, but actually what we're saying is decriminalization, and I think we can't be allergic to the word anymore. One of the other things that the Commission saw a lot of evidence about was around police violence. And there's a very interesting connection between these punitive discriminatory laws or the discriminatory application of civil and administrative laws as well as criminal law against sex workers. And that is, it tacitly authorizes the police to harass sex workers, to bribe sex workers, to perpetrate violence on sex workers. And the Commission has called for countries to take all measures to stop police harassment and violence against sex workers. And Marika spoke earlier about, sort of the links around sex work and trafficking and how that's leading to kind of an over-regulation of sex work. And one of the things that the Commission saw that was happening, even with countries with allegedly good legal frameworks, was mandatory HIV and STI testing of sex workers. Again, sometimes not being followed up with health care, and the Commission has called for a prohibition of mandatory HIV and STI testing of sex workers because it causes harm and is an ineffective use of public health resources. The Commission also has said that actually human trafficking is a big problem. They don't deny that human trafficking is a big problem. But they've said that actually what we need are enforcement of good anti-human trafficking laws which actually punish the traffickers and don't result in violations against sex workers' rights. They've also said that child sexual abuse, yes, is a very big problem and sexual exploitation is a problem, but they have to be very clearly distinguished from consensual adult sex work. And that actually those laws should be strongly and robustly enforced, but there should be no criminalization of consensual adult sex work, and consensual adult sex work cannot be conflated with human trafficking. The Commission has also called for ensuring that existing civil and administrative offenses are not used to penalize sex work. And harass them and increase their vulnerability to HIV. They've also called for an immediate closure of all compulsory detention or rehabilitation centers for people involved in sex work, or for children who've been sexually exploited, because the evidence is that these just don't work in any way and they just increase harm. Something that's very germane to being here in Washington, D.C., they've called for a repeal of punitive conditions in official development assistance, citing specifically the United States government's PEPFAR anti-prostitution pledge and its current anti-trafficking regulations, because they inhibit sex workers' access to HIV services, they violate human rights, and they actually just squander our investments in HIV. You cannot, on the one hand, spend millions of dollars on HIV prevention, and on the other hand, promote policies in your own country and abroad and laws which actually violate rights and prevent people from benefiting from those investments. And finally, I'd just like to say that there are a lot of good examples of legal frameworks and policies cited in the report, which have been evaluated. For example, New Zealand, which decriminalized prostitution years ago, put in a legal framework which is very positive, and it's resulted in keeping HIV prevalence in this population very low in New Zealand, and overall very low. It also cites, the Commission has also cited the ILO Recommendation 200 as a very positive example, but there's numerous other ones. And they've also cited the Sonagachi project that's been going on for years in Calcutta as an example of very good practice, where the legal empowerment of sex workers as well as the broader empowerment of sex workers has kept rates of HIV low in these populations and has also helped to curb trafficking, and some very interesting models there. So there's a blueprint in this Commission report of what you should do and what you shouldn't do. So I encourage people to read it. It's available on the Commission website, and we have some copies with us. So if you'd like a copy of the report, I'd be happy to give it to you after the session. And I want to finish by saying one more thing. And that's really around this whole treatment as prevention. And I was very encouraged to hear the WHO plenary say something about decriminalization at the end. It was very encouraging. But I think we have to be very cautious also about treatment as prevention is a very important intervention. But if we're looking at focusing that first on key populations, on men who have sex with men, sex workers, and injection drug users, that's terrific. And of course, as Hillary Clinton said, why rob the bank? Because that's where the money is. Well, of course, our interventions must be targeted to people who need them the most. But it's only going to work if their human rights are protected and if the laws protect their rights and respect their dignity. And so I think along with the urgency to provide treatment as prevention, there's an urgency to have legal frameworks which actually protect those who are most vulnerable. So I'll stop there.
Thank you so much, Mandik, and congratulations, and thank you for coordinating that work. I think if you haven't got the report like Mandeep said, please try and get a report. It's one of the best reports that I've ever read, so I'm plugging in a commercial for you, Mandeep, but it's an excellent report. Try and get one. Now we want to move on to Kolkata, and I don't know whether we are connected now, so keep your fingers crossed that the technology works. Can Kolkata hear us?
Can you say Namaste, Calcutta?
Yes? I want to introduce Katie Wynn, who is in Kolkata. And Katie is the chair of the Asia Pacific Network of Sex Workers. And she's the program manager of the Targeted Outreach Program of PSI. Katie, I'm going to be very slow and deliberate and ask you the question I want to ask you. What legal reforms are necessary to support sex workers' human rights as workers? I'll repeat that again. What legal reforms are necessary to support sex workers' human rights as workers? That sounds like me.
Yes, that's you.
That sounds like me. That sounds like me.
Society to keep space. Sex workers have in the involvement in the society to play meaningful role. On the other hand, now sex workers considered as criminal and they have no decision-making power. Finally, I want to say this oral profession needs lots of support to face it. On the other hand, this is economy and power. That's why we need legal status, and once we get legal status, we can reduce stigma and discrimination. We need to stop harassment, and without legal status, nothing is possible. We need real involvement in all of our work. The key demand of the sex work, Myanmar or Asia or all around the world, is simple. We demand that sex work is recognized as work. We, sex workers, demand that we are not treated as beaten. Sex work is work. Sex work, by definition, is not trafficking. Treat us as workers and not as passive beaten. And I will say that if we do anything about sex worker and HIV programming, we need to think about sex worker to include meaningful participation and nothing for us without us. Like earlier day, I wish happy and healthy life for all sex workers. Thank you. Like earlier day, I wish happy and healthy life for all sex workers. Thank you. Like earlier day, I wish happy and healthy life for all sex workers. Thank you. Like earlier day, I wish happy and healthy life for all sex workers. Thank you. Like earlier day, I wish happy and healthy life for all sex workers. Thank you.
Can you still hear us? No.
Let's just wait a minute and see if the feed from Washington with the highly skilled and mentally resourced people of the multi-million-dollar international aid society will button to push. If they don't learn which button to push within the next minute or two, I think we should just go ahead with Akram's presentation and actually speak to them.
They can hear him.
We can hear.
They can hear him.
You ready?
Yes.
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 We need to see what they're up to. If they don't learn which button to push within the next minute or two, I think we should just go ahead with Akram's presentation.
Maybe they didn't get us.
Yeah, I don't think they can hear us.
You ready?
Yes.
Yes.
See what they're up to.
They can't see us.
I'm sharing from Kolkata, and here is Akram.
Hi, Akram is going to speak in Hindi and I'm going to translate for him. Over to Akram.
नमस्कार, मेरा नाम अक्रम है। मैं भारत देश का हूँ। भारत देश ऐसा चीज़ है कि संस्कृति ये सांस्कृतिक देश है। इसमें से दक्षिण भारत है। दक्षिण भारत जो है राजा महाराजाओं का जमाने से है और हर एक चीज के लिए ये फेमस है, जैसे कि कलाकृति के लिए, संगीत कार्यक्रम के लिए, सांस्कृतिक कार्यक्रम के लिए, हर एक कार्यक्रम के लिए ये फेमस एक हमारा गांव है वो मैसूर।
I come from India, that also in the southern part of India, Mysore. Mysore is very famous for its cultural heritage as well as for the kings.
मैं अपने सेक्स वर्कर की बात कहना चाहता हूँ, जैसे कि मैसूर में कल से या परसों से या पिछले साल से नहीं शुरू हुआ है। सेक्स वर्कर पिछले सदियों से चल के आ रहा है, क्योंकि यहाँ पे राजा महाराजाओं के ज़माने से ये सेक्स वर्कर हो रहा था कि उस समय वो लोग सेक्स वर्कर के लिए बहुत सारा आत्मा या उनके लिए बहुत सारा स्थान दिए थे और अलग अलग तरह से डिग्निटी हो, अलग अलग एक ये देके उनको एक जगह पे बहुत रेस्पेक्ट मिलता था।
I come from the place Mysore, where since the king's time, sex work has been prevalent. And what was very important in those days was sex work was treated with a lot of respect and dignity.
और इसके साथ साथ यहाँ आगे सिर्फ फीमेल सेक्स वर्कर की एक ही नहीं है, हमारे यहाँ ट्रांसजेंडर और मेल सेक्स वर्कर भी रिकग्नाइज था। उस समय ट्रांसजेंडर को हमारे यहाँ जो भी जो राजा महाराजाओं के बीवियां रहते थे उनके लिए सिक्योरिटी के लिए देखा जाता था। और हमारे यहाँ ऐसा कल्चर है, ये जो भी फेस्टिवल होता है जैसे कि मोहर्रम हो या कोई दसरा हो, उस समय हम ट्रांसजेंडर हो या मेल सेक्स वर्कर को वहाँ पे एंटरटेनमेंट के लिए और उनको खुश करने के लिए जो बाहर से आए उनको सर्विस देने के लिए हम लोग को इस्तेमाल किया जाता था। और हम लोग वो इस्तेमाल नहीं कहते, वो सर्विस कहते, हम सर्विस देते थे।
Since that time, sex work was not limited only to the female sex workers. It was also among the male sex workers as well as the transgender sex workers. And in those days, transgender sex workers used to enjoy a certain privilege because they used to provide a lot of safety and security to the kings and the queens.
हम ये चाहते हैं कि सेक्स वर्कर को कोई भी अयो पाप अरे ऐसा होना ऐसा नहीं चाहिए, उनको भी अधिकार चाहिए। जो अधिकार जो है वो समानता का अधिकार होना चाहिए। जो समानता ऐसी होनी चाहिए जैसे कि हमारा वर्क है, हर एक वर्क को वर्कर कहा जाता है, तो सेक्स वर्कर को भी एक वर्कर के तरीके से रिकग्नाइज करना चाहिए। और ये हमारा अधिकार से हम मांगते हैं, ये हमारा अधिकार हमें दे दो।
Sex workers, we believe we are doing our work and we needed to be treated as other workers. And therefore, we need to have our own rights. And here we are demanding our rights as workers.
और हर एक लोग कहते हैं सभी भी ह्यूमन बीइंग है, ह्यूमन राइट्स है, हर एक चीज है। क्यों हम लोग को ये नहीं कहा जाता? हम भी तो ह्यूमन बीइंग है, हम भी समाज के हैं, हम हर एक तरीके से हम भी अपना स्थान मान हर एक जगह पे है। हम कभी किसी को कोई तकलीफ नहीं दे रहे। हम लोग ऐसे हैं कि हम लोग आज HIV प्रिवेंशन के लिए आगे आए और हम अपना रेस्पॉन्सिबिलिटी समझाए। तो हमें भी ह्यूमन बीइंग समझिए और समानता समझिए।
We are also human beings. We are not just, anybody else. We need to be treated as human beings and with full respect and dignity. And in HIV prevention can only happen if we are treated as equals as you all.
सब कहते हैं सेक्स वर्कर ट्रैफिकिंग है, एंटी ट्रैफिकिंग है। मैं कहता हूँ सेक्स वर्कर वर्ड है, नो ट्रैफिकिंग, नो एंटी ट्रैफिकिंग। ट्रैफिकिंग होना है तो मैं एक बार के लिए वापस जा सकता हूँ, लेकिन ये अपनी इच्छित है तो अपने स्वयं इच्छा अनुसार हम लोग ये वर्क को चूज किया है। ये वर्क से हमारा लाइफ चेंज हुआ है, हमारे बच्चे इसमें पले हैं, हमारे घर वाले बड़े बुजुर्ग इसमें पल रहे हैं। और आज मैं यहाँ पे हूँ तो मेरे सेक्स वर्कर के ये वजह से मैं यहाँ पे हूँ। आज मैं सेक्स वर्कर होने के नाते आप सबसे ये बोलना चाह रहा हूँ कि मैं एक सेक्स वर्कर हूँ, तो ये कहने के लिए मौका ये प्लेटफॉर्म है। तो मैं कहता हूँ वर्क, सेक्स वर्कर इज वर्क।
हम ये कहना चाहते हैं क्योंकि सेक्स वर्क, by doing this work, we are taking care of our families, of our land, and taking care of our responsibilities. So why is it that we are not treated as work? The fact that I am a sex worker, this has given me that opportunity to come here and talk to you all and present in front of you all. And therefore, we demand that it is our work.
इतना कहते हुए मैं लास्ट मेरा ये बात खत्म करना चाहता हूँ। राइट कैन स्टॉप द रॉन्ग, राइट कैन स्टॉप द रॉन्ग, ये कहते हुए मेरा अपना ये खत्म करता हूँ। धन्यवाद।
I would like to end my speech by saying only and only rights can stop the wrong. Thank you very much.
Thank you.
The
Thank
fact
you very
that I
much,
am a sex
Akram.
worker, this has given me that
also thank
opportunity
you
to come
Katrina
here
because
and talk to you
excellent
all
technology
and present in
work.
front of you
Now we
all.
want to move
And
to the next
therefore, we
session where
demand
we
that
want to have an interactive discussion from Kolkata. Whether there are any questions from Kolkata to the panelists. Kolkata, can you hear me? If there's anybody who has a question there, whether they can come forward and ask the question to our panelists. I don't think they can hear me. Kolkata, can you hear me? No, I don't think so. Why don't I hand over to our panelists? I don't think they can hear me. Are there any questions? Kolkata, can you hear me? No, I don't think so. Why don't I hand over
to our panelists?
That sounds good. I don't think they can hear me. Are there any questions? Kolkata, can you hear me?
Yes, there's a question from Kolkata. It's Andrew.
No, I don't think so. Why don't I hand over to our panelists?
I would like to ask Katie and Akram.
I think in the interest of time, why
feels
don't I hand over to Malika and see if we can have a direct discussion here while we sort out the technical difficulties.
And all the people making decisions about you are sitting over there.
Can still
6.5
continue the link with
hours
Kolkata
away, but
because
in fact millions and millions of years away in terms of the fact that we're stuck here and you're over there. And all the people making decisions about you are sitting over there.
Still
6.5 hours away, but in fact millions and millions here and you're over there.
मैं ये कहना चाहता
And all
हूँ
the people making
कि राजस्थान
about you are sitting over there.
जो रेत की जगह पे रुक के पानी मांगता है एक प्यासा, तो उसी तरीके से आज मुझे ये लग रहा है कि मैं जितना भी दूर हूँ लेकिन मेरे समुदाय के लोग सभी जगह एक ही आवाज उठा रहे हैं. ह्यूमन बीइंग, ह्यूमन राइट्स, कम्युनिटी में आगे कम्युनिटी को तो गेट टुगेदर और कम्युनिटी सेक्स वर्कर इस वर्क, ये मेरे लिए बहुत 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 खुशी दे रहा है.
Wherever we are, even if I'm sitting in the desert, and what is echoing in my ear is that across the globe, the sound is coming to me that sex work is work and it's our rights. So this is something that's making me feel very happy.
Yeah, I will talk about something we are in very different in the DC and Kolkata. But we are also talking about equal with sex work is the work. And we are demanding for our right to get equal with the other people. Thank you.
Any more questions from Kolkata? Okay, I would say, Washington, don't think that you can stop the sex workers from coming together. We are here in Kolkata. It doesn't stop us from talking and coming together. Do you think that by restricting sex workers entering the state, forget it? Is it true, sex workers?
Oh dear.
Yes! We have more fun than you in Washington.
Well, Kolkata, I tend to agree with you that you have a lot more fun than we have here in Washington. There is certainly a very lively dynamic, but thank you very much for your questions. Those were, I think, comments more than statements. Would any one of the panelists like to reflect on those comments that were made from Kolkata?
আমাদের আজ 20 years sexual freedom festival করে আমাদের খুব ভালো লাগছে এবং ইউএস গভর্নমেন্ট যে চ্যালেঞ্জটা দিল যে আমাদের সেক্স ওয়ার্কারদের কাউকে ওয়াশিংটনে কনফারেন্সে যেতে দিল না, সেটাও আমরা চ্যালেঞ্জ নিয়ে আজ আমরা ইউএস গভর্নমেন্টকে দেখিয়ে দিয়েছি ইন্ডিয়া কলকাতাতে যে আমরা সেক্স ওয়ার্কার সেই ওয়াশিংটনে না গিয়ে ইন্ডিয়াতে কিন্তু কলকাতার মধ্যে আমরা সবাই একসঙ্গে হয়েছি.
We took it as a challenge and I should say that Washington could not stop us from coming together. You may have stopped us from going to DC, but you have not stopped us from coming together. Across the globe, we have come together in Kolkata and have celebrated this Freedom Festival.
US government কোনোদিনই আমাদের রুখতে পারবে না.
US government can never stop us.
আমরা সব সময় সেক্স ওয়ার্কার এক আছি, একসঙ্গেই থাকবো. সমস্ত দেশ বিদেশের যৌনকর্মীরা একসাথে হয়ে আমরা এই ইউএস গভর্নমেন্ট চ্যালেঞ্জ, ইন্ডিয়া গভর্নমেন্ট চ্যালেঞ্জ, যে গভর্নমেন্ট চ্যালেঞ্জ হোক, চ্যালেঞ্জকে আমরা মোকাবিলা করব.
Any countries, any governments can challenge us, but we are here to fight. And we, all the sex workers across the globe, are together in it. You cannot stop us.
ইন্ডিয়ার তরফ থেকে এবং অন্যান্য কান্ট্রি থেকে আমরা অল সেক্স ওয়ার্ক ইজ ভেরি হ্যাপি কি আমরা একসঙ্গে হয়ে আজকে ইউএস বারবার আমি বলি ইউএস গভর্নমেন্টের বিরুদ্ধে আমরা চ্যালেঞ্জটাকে নিয়ে আজকে মোকাবিলা করে সাকসেসফুল হয়েছি এবং উই আর ভেরি হ্যাপি
I would like to express my happiness on behalf of all the sex workers of the world, because we have been able to take this challenge successfully against the US government and be here together for it.
Our demand sex worker as workers, sex worker rights, human rights. Thank you. আমরা
nosotros estamos pidiendo que se deroguen todas las normativas criminalizantes.
We want to stop all the criminalized laws.
El reconocimiento del trabajo sexual como tal.
We want to that we recognize sexual work as a work.
Para que así se reduzcan las mafias de malos elementos policiales que se han dedicado a extorsionarnos, a secuestrarnos, a cobrarnos cupos.
And reduce all the mafias that they are extortioning us and asking money.
Y sobre todo que entiendan que el trabajo sexual no es delito y no lo confundan con lo delincuencial que es la trata de personas.
And they need to understand that sexual work is not a criminal work.
Queremos los mismos derechos que tienen todos los trabajadores. Queremos esos
We
mismos
want
derechos.
the same right that all workers have.
Mi cuerpo es mi empresa y solamente yo soy la gerente general.
My body is my business and only me, I'm the principal director.
Thank you.
Hi, Washington. Here? Okay. This is African group. We're representing the African sex workers. I'm Daisy Nakato.
Sanya Hajarabate.
Felista Abdallah.
And Beyonce from Uganda.
We just want you to understand that even the African sex workers were able to come in Kolkata. And we are going to sing for you a song. My mother was a kitchen girl. My father was a garden boy. That's why I'm a sex worker. I'm a sex worker. I'm a sex worker. My mother was a kitchen girl, and my father was a garden boy, and that's why I'm a sex worker. I'm a sex worker. I'm a sex worker. Thank you. We don't care. You're there deciding for us. You're deciding on our behalf. But whatever happens, we are here. Back to you. Back to you. In Washington.
Well, once again, this only confirmed that Kolkata has much more fun than Washington. So I suggest next time we party together. Maybe we first take also a few questions and comments from the floor here, and then ask the panelists to respond to all of them. Who would like to? Can you please mention your name and organization you work for?
Sure. Thank you so much for your incredible presentations, and they were all incredibly enlightening. But my question is, my name is Harlan Pruden, and I'm with the Northeast Two-Spirit Society that's based in New York City.
My mother was a kitchen girl, and my father was a garden
identifying the indigenous populations or native populations? And if so, is there a way to pull out that data and to release that data? That's it. Thank you so much.
Thank you.
Maybe first take a few questions, then ask the panelists to respond. More questions?
My name is Meg. I'm with SWAP Chicago. I'll just continue. I'm really sorry if I cut you off. I was sort of wondering, so since PEPFAR's anti-prostitution loyalty oath was created in like 2003, repeatedly across the globe, people have talked about the bad effects of this policy and have increasingly documented the bad effects of treating all prostitution as trafficking. So I'm just really curious why 10 years later has nothing really been done to change this policy, and why in the US, especially in cities like Chicago, the sole efforts to improve the lives of individuals in the sex trade are really focused on rescuing these people. Thank you.
Hi there, yes, Eric Carlson from the ILO in Santiago, Chile. I work with HIV/AIDS in South America. We've been working with trans sex workers in Chile for the last couple of years, and we're trying to identify the next steps ahead given limited resources and what we can do. And they've come up with about 3 different groups of work that they'd like to see done. One is linking to established unions, mainstreaming them into labor rights. One is reducing violence and harassment. And another is for those who do, some choose sex work and some choose to do other types of work, and to look for job creation in other fields for those who want to. Given limited time and resources and everything, from a labor perspective, what do you think is the most important step forward? What should we concentrate on first? A lot of our colleagues in the trans sex workers are very concerned about violence. Some would like to really see an end to violence first before looking at other issues. What is it then? Mainstreaming on labor rights, reducing violence, alternative job creation for those who want other jobs, what are your thoughts on that topic?
Thank you. This side.
I'm Margie Haverkamp from the Netherlands. I'm a doctor and a relative outsider to this discussion. And this might have been talked about before a lot already, but I was thinking as an approach, worldwide approach, would it be more accepted to go from the perspective of a pragmatic, to take a pragmatic perspective and say sex work is there, so, and then go from there and then take the human rights in it, instead of advocating sex work is work, which has also a moral, like you said, Mr. Howard, a moral side to it.
Take maybe one more question over there, and then first switch to the panel.
Hi there, my name's Anna Sani. I work with Vocal New York in Brooklyn here in the United States. I wanted to say that obviously, I mean, we're so inspired by the sex worker activism overseas, especially as an Indian sex worker here in the United States. I share Naomi's deep sadness that we can't benefit from meeting you in person, but so this travel ban does so much violence to us here in the United States as well as the people overseas. What I've experienced here in terms of sex worker activism is that it's very much dominated because of overlapping oppressions by white sex workers, middle and high-income sex workers, and there's a real absence of the massive movements, mobilizations that we see overseas of poor sex workers of color. So I'm wondering if anyone on the panel can provide some advice as to how we can, join as sex workers, the most at-risk sex workers and the sex workers that are so in need of organizing, how we can make that happen on a massive level here in the United States and Canada.
Thank you. I just discussed with my co-chair. We take these 3 more interventions because we have to wind up and then ask our panelists to respond. So, you first.
Thank you very much. Mine actually is just really recognize the HIV Global Commission for the work that was done around the globe and the process that really you used, where you engaged all sex workers, transgender people, MSM to evaluate, but also to do the assessment within the countries. And then at the national, like the regional level, that the presentation that was done, that was really great. I think it has been the first platform that we've had, and I don't know whether it will happen, especially with all the policies and laws that are happening around sex workers. Then I also acknowledge NSWP when I see the Kolkata team really, of sex workers, transgender people giving out the voices with their passion. I think they've really had much fun than we've done. And what is happening here, it's really like we are just a drop within the sea. I feel our voices have really not been really presented. The information has been denied, and yet when you look at the programs and the activities were really good for us to speak about, for us to share information, but also to give the challenge, to share the issues that really affect us. But then all these informations and chances were prohibited by the travel ban restriction. At the other hand, just like the person who has just left the floor, I feel we've been denied a lot of information and also access to share our experiences and what is happening within in countries. The violation is really, really high. The attack is very high. The stigma and discrimination is very high. And I'm wondering, what is this really going to be at the end of the day? Yes, we've been here. Some of us, we maneuver to come in. But after here, what is going to happen? What are we going to do? Thanks.
Thank you. I'm sorry, you really have to close down the number of interventions because I really want to have some panelists to respond. I think you're next.
Hi, my name is Jim Matarazzo. I'm from the International Network of Religious Leaders Living with HIV in Arella, and I'm a board member. My question to the panel is, and I'm anticipating a negative response, but I'm looking for positive responses, if there are any, in your encounters with the faith community and religious leaders who have taken a more progressive stance on interventions with the sex worker community. My organization does work progressively and affirmatively with the sex worker community, which is, I think, unusual in the faith community. So I'm curious as to your responses. Thank you.
Over there.
Hi, my name is Deanna Baskin. I'm with the Sex Workers Project in New York City. I'm an attorney and I represent sex workers and victims of trafficking, and I just wanted to offer a comment. I think those of us who care about sex workers' rights and health are sometimes feel blindsided by the anti-trafficking movement when we really should be working together. Anti-trafficking is a labor rights violation as much as it is any other kind of violation, and recognizing sex work as work would actually benefit victims of trafficking as well. I just have one tiny example. I represented some victims of trafficking who were trying to get compensated after they've been trafficked. All their earnings had been taken from them by the traffickers, and the courts ruled that they could not be compensated because those were illegal proceeds. So just one example of an injustice that is perpetrated against everyone in the sex industry by that not having that recognition.
And then the very last intervention.
Okay, I'll keep it quick. Hi, I'm Cassie, and my question is, well, a little bit of a statement. I think maybe everyone probably found this panel really inspiring, and if you weren't already an ally, maybe you are now. So if maybe the panel could make some quick remarks about, what the little people can do to support sex workers. I think there's lots of great grassroots movements and things we can do to support each other. So if you could make a comment.
Yes, we now give our panelists the opportunity to respond to the comments and questions. Naomi, would you like to go first?
Yes, thank you. I lost track of a lot of the questions. However, I would like to address, I think, part of why there isn't enough sex worker representation in the movement in general, not exclusive of the travel ban, as to why they couldn't be here with us. The dominant funding around HIV around sex work is HIV related. There's so few dollars that are given to sex worker organizing and activism and for us to fight for our rights. At the St. James Infirmary, most of our budget is around HIV prevention. And so that's where we end up, and we're a direct service organization. And then how do we then, because it's a sort of stably funded, well-staffed organization, we are better positioned to be able to advocate for our rights to send people, to afford to send people to come here. Most sex workers are not getting scholarships to come to this conference. They're not getting a salary to organize other workers. We don't get any money for organizing or activism or for policy work. We have to do all that through our fundraising of general funds. And that's disappointing, and I think that needs to change, and we need to advocate for more money to go for just basic human rights advocacy work for sex workers. I have to say, too, when I was a worker, and I worked for many years, I wasn't aware of the sex worker rights movement. I was really busy making money. And so I think we need to figure out like how we can help sort of bridge the gap between workers who have to struggle to pay the bills and struggle to pay the rent and to take care of their kids and take care of their families. And rent is high. So how can we sort of make that happen for people? And it's through compensation, it's through scholarships, it's through stipends, it's through economy. Thank you. And the anti-trafficking movement it's a slap in the face in a way, because all of us in the community, in the sex worker activism movement, we are all against trafficking. It's horrible. And then when it's conflated with the work that we're doing, or when we see all of these anti-trafficking funds going to local police departments to make raids and rescues on adult workers who are engaging in a consenting behavior, and to justify that as this is some kind of rehabilitation and it's for our own good, it's really insulting. If you've ever had a problem in your life, how would you feel if the police came and arrested you and threw you in jail to help you with your problem? They strip searched you, they bent you over, they stirred up your asshole. You had male sheriffs watching you take a crap and shower and were violated. And that's your help. How do you like that?
Just to briefly respond to the question about data on the Native American community, our review was focused on lower and middle income countries, so we don't have access to that data right now. However, we definitely saw higher prevalence among ethnic minorities and migrant populations in that review, so it certainly highlights the importance of that issue.
Just one comment on what is next. I think it's essential that in parallel with efforts to promote or to ensure decriminalization, that we also need to see trade union, sex worker participation in trade unions to begin negotiating labor rights now and addressing these violations. I'd like to introduce Susanna Muscat-Gorska, who was on the International Trade Union Confederation. She's the coordinator for our HIV programs, and she was one of the main advocates for sex worker inclusion in Recommendation 200. So I think that we need to begin forming alliances, both at the international level and at the country level, to include sex workers at the table in national tripartite mechanisms to negotiate labor rights.
I'm going to try and address a number of the questions that came up, but I also haven't kept track of who asked what. But I think someone asked about priority. What are priority actions? I think violence reduction is a priority action. I think it's one of the most egregious human rights violations, and it's something that everybody can get behind. And that's an important thing to do. And just to kind of encapsulate the Commission's recommendations around decriminalization, they're very much about, well, decriminalization alone is not enough. It's about decriminalization, reduction of violence, access to quality, appropriate services, and legal protections of human rights, including the right to work in safe conditions. And that's really what the main message is. From that, I'd really like to say that, for me as a feminist, it's really depressing that feminists are waving the anti-trafficking flag. And I think as a feminist, I'm a sex worker rights activist too, and I just think it's high time that people realize that sex workers' rights are not special rights, they're human rights. And they're women's rights, they're children's rights, it's the same thing. And I think in order to really kind of tackle the harm that's happening, that's being caused by this, completely misguided anti-trafficking effort, that we really need to bring together the women's rights movement, the sex worker rights movement, and the HIV movement to really aggressively, put this anti-trafficking effort back on track into doing what it needs to be doing, which is preventing trafficking and not violating the rights of sex workers and increasing HIV. So I'll stop.
Thank you, Mandeep. I think you've summarized it well there. And thank you to all our panelists and everybody who's asked questions and people in Kolkata. Can I just invite my co-chair just to give a few concluding remarks?
Well, quite difficult actually to sum up such a very rich discussion. Just a couple of points. I think first of all, the very important point that we really missed the input of our friends in Kolkata, and I hope this is the last time that we'll have separate meetings. I think it is very interesting from our two panelists from Kolkata who provided the historic perspective that indeed sex work is the oldest profession, and in the past sex workers were treated with respect and had very different positions in society. So somehow things have gone wrong and we really need to turn that around. I think, Naomi, you started very clearly, like, why should we ask whether sex work is work? Of course it's work. What else would it be? So I think we can be really short on that. There's very abundant evidence provided by all the panelists that sex work is work and should be recognized as a legal occupation, both from the sex workers themselves, from the labor perspective, from a human rights perspective, from a public health perspective. So how do we make all this abundant evidence into policy? Because we all know that before evidence gets translated into policies, there's politics, there's morality, there's ideology that come into that impact and stop it. So how do you really affect those issues? And then there's the confusion between the trafficking, the exploitation, and sex work. So they're really very different issues, and I'm really pleased that the Global Commission's report is so clear about that these are different issues and should not be confused. I think the partnership that came out is very important. The trade union, there's actually a trade union for sex workers in the Netherlands, and they have in the past been supportive of sex worker organizations in other countries to help them come up with their rights and protect their rights. Really important. And the really very important thing is sex worker leadership. And I think we've seen a lot of it in this conference. I think there's much more of it in Kolkata. So really pleased that we saw at least a glimpse of that leadership through our linkage with the Kolkata hub. And I think last message would be to the International AIDS Society that no more AIDS conferences are organized in countries that ban entry to people that should be part of our dialogue. Thank you.
Thank you very much, Naomi. And I think it's very clear that we've come a long way, but we've also got a long way to go. And we can only get there if we all work together. Thank you all the panelists, and thank you everybody, and thank you Kolkata. Thank you for coming to the session.
We need to think more about how we can promote the labor movement too.